Good afternoon, everybody. We are getting still a pretty steady stream of people joining. So I'm going to give it just another minute or two and then we'll get started.
Hello, Brian.
Hello there.
Hello.
Hey, everybody. We have people chiming in. It's about 12:04. I'm going to give it one more minute just while people get their Zoom going and then we'll get started. All right, well, we are at 12:05. I have quite a few people who have joined, which I'm just absolutely thrilled about. There's sun shining outside. It's lunch hour. You could be anywhere but here, but you've chosen to spend it hearing about the stuff that Solvista Health is up to. So thank you for that. I'm really excited. We're also going to record the presentation and the slides. So we'll send that out to everybody that was on our distribution list and everybody here today so that you can refer back to things and share it with whomever else in your networks you would like to, because really what we're hoping today is to spread the word and to help honor our commitment as a community mental health center to provide updates, to receive feedback, and to be in constant communication with our community. That's what we do as a nonprofit. We exist to serve, and this is an important way that we can keep everybody on the same page. So glad everybody is so comfortable with Zoom now that we were able to get so many participants. And we'll go ahead and jump in. So we have two goals for today. And the first is to provide updates about where we're at on this project we've been working on for a couple of years with support of so many community members, and a call to action, specifically for the Regional Assessment Center, our crisis facility. The second goal is to introduce and share with you all the really exciting news that we have a new grant and grant initiative and project supported by the U.S. Substance Abuse Mental Health and Services Administration called Promoting Hope. And this comes in recognition of the heightened behavioral health crisis due to COVID, and gives us some very needed resources to take a more active role in suicide prevention work in our communities and really build a collaborative framework to help decrease suicide risk and save lives. So those are our goals today. My name is Brian Turner. I'm the CEO for Solvista Health. And I'm joined today by Tammy Moruzzi, who is our Chief Nursing Officer. There's Tammy. And Debbie Palmer-Thomas is also out there. She is our Director of Crisis Services. And as such, there's a high likelihood she will be called away to manage a crisis. So she's here hopefully for the whole time and can help with questions and answers as our expert in-house. And then we've got some other great Solvista staff on as well to chime in if we need it. So quick bit about Solvista Health, and I won't spend much time here because a lot of folks I recognize on the participant list for the Zoom call probably know a good deal of this. But we serve 4 rural and frontier counties, Chaffee, Custer, Lake, and Fremont. We currently have 8 and some part-time space locations across those 4 counties. And by the time we open this facility, we will be at 9.5, we'll call it an even 10 locations, which is up from just 4 about 3.5 years ago. So some pretty significant growth over the last several years. And you can see that in the last bullet there that we have gone from serving 2,700 in 2017, and we were over 5,000 individuals served in fiscal year 2021. We do a lot of different types of services, and a big part of what we're going to talk about today is filling a critical gap in the continuum of care. But we really try to make sure that we're providing services, everything from prevention and wellness through crisis services and recovery care. And we serve all ages, all individuals, all are valued at Solvista. That's a key value for this organization. And we accept all payers or individuals who don't have a payer, and everything from sliding fee to free services available.
Brian, I'm only seeing your first slide still, recovery is possible. I don't know if that's the same for everybody else. There we go.
Thank you for chiming in and letting me know that. That would have been confusing as we kept going forward. All right. So we are very big on starting with the why at Solvista Health, our personal, our individual why, as far as why we do this work and why it really is a part of our purpose that we share here at the organization. And also thinking about our communities why. Why do we need the programs that we're going to walk through today? At the core, I believe it's because people are resilient. And when we talk about resilience, an easy definition is that we have the capacity to recover from difficulties. We're challenged in many different ways in our lives, but with the right tools, the right resources, connections, and support, we adamantly believe that recovery is possible. And these programs are examples of the resources and tools that we can put in place to help with that and to help demonstrate that people truly are resilient. This is a little bit of the statistics, and I don't want to spend too much time on this. Again, you'll have the slides for reference afterwards, but we cover the 4 counties I mentioned, which is about 3,700 square miles. We rank highest in the state for unmet substance use disorder treatment needs, and among the highest for reported mental health challenges, unmet need, and as a region that has a high population of people who are medically underserved. We have been very hard hit in terms of the drug overdose epidemic. A lot of drugs in there, not just opioids, and emergency department visits for those overdoses as well. But certainly opiates, heroin, benzodiazepines, but throw in there methamphetamines, alcohol. We have, unfortunately, some very high rates of substance use. We have among the highest suicide rates in Colorado. And because Colorado is one of the leaders in the nation, we are talking about counties that rank among the highest in the country for suicide rates.
Brian, we're also getting a message from people that they see a black box covering part of the slideshow. Sorry.
No, thank you for being the assistant there. Is that better right there?
No, that's better. You got it.
Thank you. Just as I was patting us on the back for learning technology. And then this last piece, behavioral health, mental health, and substance use has been consistently ranked as a top priority by our public health departments and their public health improvement plans. Just a quick graphic demonstrating the consistent rise in age-adjusted suicide rates in the counties, in our 4 counties. Okay, here's where it really gets fancy, so bear with me. So talking about the why, more importantly, what are we going to do about it? And so want to share this video that we've put together about the Regional Assessment Center. Okay, give me one moment.
The Regional Assessment Center is hope. It's opportunity. It's the result of what happens when people from different backgrounds, different perspectives, different walks of life come together and own a challenge that we all share. Own it together, and more importantly, solve for that challenge. The Regional Assessment Center is a first-of-its-kind facility for higher levels of mental health and addiction care. It's located in this picturesque environment in the upper Arkansas Valley of Salida, Colorado, on the same campus as the Heart of the Rockies Regional Medical Center. What it is going to offer is crisis services for mental health and substance use. 24/7, 365 walk-in services where you can come in and you can get support from trained clinical professionals and also, really importantly, a staff of peers, individuals who have had lived experience with mental health challenges or substance abuse. Certified peer support specialists who have this unique magic, this ability to help connect with individuals and get them the support that they need and get them engaged into recovery. The Regional Assessment Center is going to provide a level of care for mental health and addiction services in this part of the state that has never existed and doesn't exist, period, for over 13,000 square miles. That's a big deal. That's a lot of people who are going to get an opportunity for health and well-being because of what we're working on here together. The reason we chose Salida as the location is because it serves as this geographic hub for an entire region of southern Colorado. We're going to serve this population that has not had its needs met before. But I think it's really critical that we talk about it in terms not of this population as if it was some group of people out there that is different from ourselves. The truth of it is, we're talking about our neighbors, we're talking about our family members, we're talking about our friends, we're talking about ourselves. This is a challenge that we may all face at one time or another in our life. And so knowing that you have that resource available, whether it's for yourself or for a loved one, that is the peace of mind that comes with having the Regional Assessment Center. Our hope is that we are creating a more complete continuum of care in partnership with a lot of other community service providers in the region. We want to bring our services to people to make them accessible and give people the greatest opportunity for recovery.
Hey, if you're trying to get in
Okay. So thank you again for your patience on getting that video going. I mentioned the donut hole, and this is just an illustration, and it really is a massive donut hole.
Can you
Over,
get us back to the slideshow? There you go, thanks.
you seeing the map of Colorado?
Yes.
So this is the donut hole. This is a over 15,000 square mile region where we do not have the appropriate higher level of care for mental health and substance use. And our position is strongly that it is not acceptable, that we need to have people leaving their communities, leaving their networks, leaving their social capital, the people who can help them with their recovery, to go to the I-25 corridor or somewhere along the I-70 corridor to get the services that they need. So by putting this centrally in the middle of this donut hole, we hope to really create an opportunity for the first time in this rural and frontier part of the state to keep people in their communities and help them get connected and supported into recovery. We know that crisis care is one of our greatest opportunities to save lives. And importantly, those moments after somebody is supported in crisis is our greatest opportunity to engage them into ongoing recovery. If we can help somebody in that deepest, darkest moment, we can then get them into the services, the rest of the continuum of care, provided not only by Solvista, but other providers in the community, the medical community, all of our other systems partners. Those are the things that really help people to be well and to thrive moving forward. So I'm going to turn it over to Tammy Moruzzi now and have her walk through a little bit more specifically of what the Regional Assessment Center includes and where we are at with our. Tammy?
Hi, everybody. It's nice to see you all on this Zoom meeting. So I am super excited about this project, and it's fun to have some graphics that we can put up that show the Regional Assessment Center design. So on the right-hand side, on the upper, is what the building looks like from the outside. And one of the things that I wanted to make a mention is that you'll see these, they refer to them as dog houses. I don't know why, it's a construction term, but I kind of like it. But they're the clear structures on the top, which allow for a lot of light to come into the building. When we were designing this building, one of the things that we felt strongly about was that it needed to be a space where people felt like they could come, get treated with, you know, compassion, care, dignity, respect, and get the services they needed in an environment that would help them heal. And that's what we designed. And so you can see on the upper left, that is one of the units. We have two units that pretty much mirror each other. One is for our Crisis Stabilization Acute Treatment Center, and the other will be our withdrawal management. And they each have 6 beds. And as you can see, when we designed it, we really tried to have some open, airy spaces and a really pleasing color palette. We're also located on the Heart of the Rockies campus, which we're really also excited about because it gives us really easy access to the hospital, and they've been great partners to work with. And so we're excited about that. One of the things I think they really liked and that they've highlighted several times is how close we are to their emergency room. So we can work hand in hand with them to get patients back and forth. Our regional assessment center is going to house a couple of different programs. First, that's where we're going to house our mobile crisis program out of. So that'll be like the hub of the mobile crisis. Each one of our communities has a crisis team. And this actually allows us to have a central location where they can coordinate services. And we have offices for our RAC director and our mobile crisis director. Those two programs are going to have to work hand in hand. And so having them all in one location, I think, is really going to make for some great communication and efficiency of care. So in the RAC, we have our mobile crisis, as I said, but we also have a couple of other programs. One is going to be our crisis living room, where you can walk in, come up to the facility. You can walk in and let somebody know who's at the front desk that you're having a crisis, and you will be taken back, and an assessment will be completed, and that will help you develop a relationship with the team. And then together, you and the team, you'll work together to decide what pathway looks right for you. It may be appropriate for the patient to stay in the crisis living room for several hours while they, deal with the stressors that they're having. Some people may need to go to the withdrawal management unit. And so during that assessment, we'll decide if that's the right pathway. And then some people may need to go to the crisis stabilization unit or acute treatment unit for a little bit longer, more intensive care. And then if a higher level of care is needed, and this would be like a acute hospitalization, then the person could be transferred to that area.
Tammy, you have that rectangle in the middle of your screen again. I think it might be related to your cursor moving. If
We have that box.
There you go. But there's a little one at the very top, but it's not covering the slide. Thanks.
So while we're working with the patient and their family, their support system through this assessment process and trying to figure out what pathway is the right pathway, we have several different types of care that can be provided by several different individuals. And we are really focusing on utilizing our peers to help this model. One of the things that we have found is peers who have lived experience with mental health or substance use issues can really be helpful in providing comfort to the clients. They see things from the client perspective, and because of their lived experience, they can experience things differently than people who may not have lived experience. They provide a level of support and care and compassion that I think is very, very comforting to the patients when they come into the facility. We'll have trauma-informed care and, of course, very culturally sensitive, and we'll be able to utilize resources to help people who may not be English speakers to receive the care that they need. When we first started this, it was kind of new to all of us. We've done a lot of program building, but I think for most of us, this was the first time we went down the pathway of developing an acute treatment center, a regional assessment center. And so we really wanted to get our mind around what services were we planning on providing and how do we do that? And so we developed a logic model. Debbie Palmer Thomas was actually, this was one of her babies. And it helped us really congeal our thoughts around what are we trying to do at the RAC? What are our values? What are our delivery processes? And then how are we going to measure our successes? I think it's always easy to go into a project and you get focused on a lot of other things, but measuring success is really important because we have to know, are we really making a difference in people's lives? Are we really helping the community meet the needs that they've expressed to us from this, like, helping reduce ER burden, helping divert people from jails and incarceration. So we really wanted to put our mind around this, and this is what we came up with. And I think this can help you all see, what level of services we're trying to provide in each area, and what our thought process was. And I'm happy to answer questions about this later if you have more questions. So I think for me, when I started really thinking about this whole thing, the thought that really occurred to me is, if I was in a crisis, what would I want my experience to be like? Or if my family member was having a crisis, what would I want the experience to be like? And I spent a lot of time talking to the team about this. This is one of our guiding principles, right? When we decided to do this, was how can we come up with a program that meets people's needs and really provides the support, the compassion, care with dignity. And what we thought of is that when people walk through the door, they should be able to access these services. So meet a peer right at the beginning. Have an assessment, decide, is stabilization and return to the community the right pathway? You can stay in the crisis center for up to 23 hours and get the supports that you need. So not everybody needs a higher level of care. Some people just need a break, right? They just need to come. They need to have a couple hours where they can get away from their stressor, really get their thoughts around what they're, what they would like to have happen in the next 24 to 48 hours. And then have staff that can help them process that and figure out what the goals of the next couple of days should be. We also have case management and peer supports, as well as clinician supports that are available to help people really get their, get a plan about how they're going to work through this next little period of time. One of the things that we have had a lot of experience with is withdrawal management services not being readily available. And this goes back to that donut hole that Brian talks about. It's very, very difficult for us to send people outside of our community when what they really need is to be provided with care in the community where their natural supports are. That's huge. It would be like, we do this with physical health care all the time, right? People have a physical health care issue and they can usually access care within their community and they have their family with them. But when it comes to some behavioral health care, it gets fragmented. A person's sent off, their family remains. When they really need their supports of their family and friends and community employers, sometimes they're sent miles and miles away. So one of the things that I'm most proudest about is that we are going to have withdrawal management services right in the community. People can come in, they will be provided with a detox unit. I like withdrawal management better. And we will have some medical oversight there, although we are not running a medical detox unit. We will have the ability to help provide some medications to alleviate some of the symptoms that people have when they're withdrawing from substances. Our goal is that this is going to be a safe place where they can start to build relationships with a team of people who are hopefully able to help them walk down the path of recovery. I think that's one of the biggest things that we understand, is that this isn't a one and done, right? This is a journey, and you need people around you, your treatment team, as well as your support systems, who can walk down this pathway of recovery with you. And so we're really excited about that. We're hoping that we can get people connected before they even leave the withdrawal management unit with staff from our substance use disorder program, who can help them just integrate and flow right into the next level of care. The crisis stabilization unit, I think this is going to be really great, because it's going to offer us a place where people can come, as I said, get out of the environment or stressor situation they're in. They don't have to leave our community. They can stay here for 7 to 10 days. We will have a psychiatry staff available to assess them to determine if they need to start on medications. There'll be case management, peer supports. We can help with stuff like making sure that when they leave, they have the community supports and resources that they'll need, work on stuff like housing and nutrition and transportation. So we're really excited about this piece. I am really grateful that we won't have to send people out to hospitalizations as much. We might still occasionally have to utilize that higher level of care, the acute hospitalization, but our hope is that most of the people that we have can either come to the crisis living room and receive the help they need, or come to the crisis stabilization unit and get what they need, so they don't have to go into that higher level of care. And as always, we're a recovery-based organization. We feel very strongly that this path is a path that leads to recovery. So helping people through developing relationships with them and understanding that we support their journey. This can be anything from the case management services that I've talked about to with withdrawal management, maybe helping with sober living or supportive housing, referring people out to community partners. One of the biggest things I say about the RAC is, while this may be a project that has Solvista's name on it, it's a community project. We could not do this without everybody in our community. And this includes those people that are going to help us support patients after they leave the unit. So we know that this just isn't about Solvista and Solvista Health Services. This is about all of the people who are involved in the community and are really helping people on their path to recovery through services that, you know, we partner with them to help provide. So we're really excited about really enhancing those community relationships. And we are now in the building phase. We actually have, I think I heard, I'm gonna go check it out tomorrow, but I think I've heard that we have walls up. So last time I was there, we had roof structure, we had structural beams, roof structure. Now I understand we actually have some walls going up, so you can start to see more defined spaces. We're really excited about that. We're really hoping to finish this project in March, April of next year. We did this during a pandemic, and I still sometimes wonder, how did we do that? But it did delay our timeline a little bit. We did find that we ran into a little bit of struggle. So, we had hoped to have it done a little earlier, but really excited that we are full steam ahead, on track. Every time we get a construction report, it's go, go, go. So our architects and our construction team are doing an amazing job, and I'm looking forward to a grand opening in April of next year. So that's going to be here before we know it, actually. And then last but not least is fundraising. I know Brian's going to talk to you about this, but this is, again, something we can't do without community partners. And so fundraising is an absolute key to this project. And we've appreciated all the supports that we've gotten so far.
Absolutely. One of the key pieces to highlight here, hiring and onboarding of new staff. So we are actively in the position of defining, kind of finalizing all of the job descriptions. Those will be posted soon because we want to make sure that we can get, is it 28 FTE, Tammy?
I'm pushing that a little now. I'm like, maybe 30.
Okay.
Brian's probably going, oh, what are you talking about? But we actually have a job posted currently for RAC director. So yeah, I'm really excited about that.
Yeah. So that'll be one of the plugs. Definitely looking to fill our workforce needs as we move forward on that. Here's a little bit of a picture of what Tammy was describing. And these are actually been a couple of weeks. You can see Miss Moruzzi right there with former governor, current Senator Hickenlooper giving a tour a couple of weeks ago. Our appreciation to Heart of the Rockies Regional Medical Center for setting that up with the senator so we could show off the new project there and build some more excitement around it. But it is indeed coming together, and even more so than these pictures demonstrate. Tammy mentioned fundraising. I'll mention it as well. We have a $7 million project budget for the Regional Assessment Center. You can see the way that that breaks down between government, foundation grants. That includes grants through managed service organizations or regional accountable entities. We have individual giving goals. We have corporate donation goals. And then we have the remaining amount for financing through a bank loan. So obviously I would like to see that number get as small as possible and have a lot more success in all the philanthropic side. The green though is what's already been secured, and the red is kind of our missing gap. So we are certainly making progress, and hope that through some partnership and advocacy, we can really start to take off on the corporate and individual giving side. Tammy also mentioned this is our project. We've received over 50 letters of support and commitment from anybody you can think of. Advocates, law enforcement, hospitals, public health, DHS, school systems, county elected officials. It's been a very impressive collaboration, a lot of input into the design, and it's going to be an iterative process. We own this together and we're going to keep making it better together. So all of us we share in this responsibility for our communities. We're happy to be taking the lead at Solvista, but look forward to continued partnership. So here's the ask, here's the call to action that I mentioned at the beginning. Certainly, as we look at those numbers for the fundraising, it's a lot of money. We believe firmly that there is a sustainability model, a financial model that can support this ongoing. But the reality is there's not a whole lot of money floating around out there to invest in capital. Our appreciation, sincere appreciation to Solvista Health, to Representative Jim Wilson, who co-sponsored House Bill 1287 to help make the funds available for the grants that Solvista Health has offered, to Health Colorado, the regional accountable entity and Medicaid, which has also contributed. But we need to keep going there. We need to get the rest of the way. So visit our website and share that website with your friends to hopefully help us raise more dollars. There are more grant opportunities coming down the pike. American Rescue Plan, Senate Bill 137. We need advocacy with our county commissioners, with our state legislators to continue to push for resources to come to rural parts of the state to build levels of care that do not exist and have never existed before. So your advocacy is appreciated. Again, share this information with your networks, encourage your connections to donate, and share the opportunities for a new job with any prospective job candidates. There's a lot of FTE to be hired in Chaffee County, and appreciate anything you can do to spread the word far and wide. And then especially for systems partners, especially for folks on the advocacy side, we need to have more conversations, and we're getting a lot of these scheduled right now to make sure that the workflows, referrals, clinical pathways, what happens when you're done at the Regional Assessment Center and you're going back to Park County, Saguache County, Lake County, Fremont County. We want to make sure that's really seamless and that it actually is helping to meet the needs and the expectations of course, the individuals we're supporting, but of our systems partners as well. So I'm going to transition now away from the Regional Assessment Center into a very complementary but separate initiative. And this is, again, Promoting Hope. Promoting Hope is a grant from SAMHSA, the U.S. Substance Abuse Mental Health Services Administration. It's a mouthful. And they released this opportunity some time ago, directly in response to what we were seeing even in 2020, which was mental health acuity, substance abuse risk really going up as a result of COVID and everything that we've all experienced together as a result of COVID. So the grant we were really excited to be awarded has these clear objectives: decrease suicide risk, promote individual stability in the community. We can really do that by enhancing social connectedness, making sure that individuals are getting engaged into community-based care, and not relying on inpatient hospitalizations to be the only place somebody can go. And usually that is the result of they've kind of exhausted all options or limited options and haven't known where to reach out for care and support. So our strategies that we put forward and that were awarded are to provide an additional level and more resource for intensive evidence-based treatment. Evidence-based means it's proven. Randomized controlled trials, kind of the gold standard of evaluation, has been applied to, tested on these interventions, and that's why we chose the ones that we did. We'll walk through what those look like. Comprehensive care management, the individual therapy, the psychiatric support, peer supports, those are all extremely useful. And case management goes alongside those pieces with helping to kind of be the nexus and pull it all together into a comprehensive treatment plan. And making sure that not only our providers, but other providers in the community and other community stakeholders can get some training on suicide prevention. More specifically, we are tasked with rapid follow-up with any adult who has attempted suicide or experienced a suicidal crisis and entered into an emergency department or an inpatient psychiatric hospital. So as soon as there's that discharge, we will have already been in contact and supporting that individual to make sure that they have the supports they need in the community. Primary priority is ensuring individual safety. Again, for those individuals who are at the highest risk in a number of different settings, certainly not limited to emergency departments and hospitals, but anywhere that we might identify someone as high risk. A key focus for this grant are victims of domestic violence. So we will be targeting and partnering with our domestic violence provider organizations and advocacy organizations across the region to make sure that we are particularly helping that population in addition to any at-risk adult. Providing suicide screening, assessment, and appropriate retreatment referral to clinical treatment. Providing that full continuum, not just of the things that Solvista can provide, but a number of different community-based supports. And that extends to the family or to other individuals who are in the household. Suicide, it impacts everyone. It impacts the people around the individual and has this sort of rippling effect into the community. We want to make sure that we're supporting everyone in that ecosystem. And providing that training directly to the community, as I mentioned before, and of course, including telehealth as a part of our continuum. All the things that Solvista Health does continue to be available over telehealth as well as in person. So to shift a little bit to the training, because this is a key opportunity for some partners who are on the call today. First and foremost, our training philosophy is that we never shame or blame a suicidal person for being suicidal. The focus of our training and the entire framework that we will apply with this grant and that we apply already at Solvista is that we're endeavoring to understand the struggle through the eyes of the individual, through the eyes of the suicidal person. So with that as our foundation, there are really only 3 evidence-based programs that have been proven to work to reduce suicide risk. And they are DBT, dialectical behavioral therapy, CBT, cognitive behavioral therapy, and CAMS, the collaborative assessment and management of suicidality, which is really more of a framework and a hands-on collaborative approach to make sure that we're getting folks into the treatment and the supports that they need. So CAMS is a huge emphasis of this grant, a therapeutic framework to have a different level of assessment. We're not just saying, are you at risk of harm to self, or do you have a plan for suicide? It really is a comprehensive assessment on somebody who is at risk to determine what are the risk factors, what are the contributing variables that need to be addressed, and how can we best support somebody. It's a very flexible approach. Again, really involves collaboration with community partners and more than just the individual clinician who happens to complete the assessment. And we can apply it in a wide range of settings, and it's been proven to work. The other intervention is DBT. And so this goes hand in hand with CAMS, the second of the three evidence-based programs for reducing suicide risk. And this is a strategy clinicians use that focus on teaching people how to kind of live their best and most productive life. We're talking about being in the present, developing coping mechanisms, how to regulate our emotions, recognize when maybe our emotions are in control of us, and really focus on improving social connection in the community and their relationships with others. So frequently through the CAMS framework, we identify the benefit of DBT, and that can be a more targeted therapeutic intervention. But we want to extend the training on CAMS and DBT far and wide to clinical staff and non-clinical staff to make sure that people have some tools in their toolkit to help. Quick bit on staffing. We have more jobs posted on the Solvista webpage for people to explore and hopefully apply for. We need a supervisor for this project, 2 master's level clinicians, actually 3, but 1 will have a specific focus on supporting the domestic violence community. Case manager, as I mentioned, that being a really important piece of helping to keep the holistic approach of treatment together. And then 2 dedicated peer specialists to this program. All of these staff work hand in hand with everyone else at Solvista, and specifically our crisis team, which I'll brag on them right now, is one of the best in the state. So having this as a complement and addition to what we already have at Solvista and deepening our training and collaboration with community partners, I think is going to mean a very significant impact in reducing suicide for the region. It's a short timeline, unfortunately. A lot of this money for grants at the federal level is tied to the American Rescue Plan or previous COVID relief packages. And so there's a pretty tight window on the projects that we need to put forward. But right now we're in this outreach and engagement phase of community and partners. We will initiate training on CAMS and DBT in October 21. Really have those trained staff implementing the services, the strategies that we're talking about with this grant beginning in November after training concludes. Additional training, intentionally designing a second round of training around the opening of the Regional Assessment Center. We will do formal program evaluation with a third-party evaluator to help us demonstrate, hopefully, the very positive impact that this grant will have. And everything is intended to wrap up as far as the grant dollars are concerned by December 2022. Of course, we're going to continue. The idea is that we're building this in to the very fabric of what we do. And so we will plan on sustaining all of these activities, but the SAMHSA funding at least, and the reporting period will end December 2022. Okay, we've covered a lot. Wanted to leave a little bit of time, and would have more time if I could figure out how to use Zoom and YouTube. But we do have about 9 minutes, and I'd love to open it up for any questions that people have on either of these 2 programs. And again, just before that, there are some important resources. We'll send these out to everyone so you know where you can go back for more information as well as for this presentation. So with that, I'll stop my share. And do we have any questions? Check in the chat. And we have confirmation that walls are up. So that is very exciting news. I'll be up there tomorrow.
That is exciting. Every time I go up there, I have this sense of like, it's real. It's really happening. So I'm excited to see the progress. So thank you, Leslie, for confirming that the walls are up.
That's right. All right. We don't see any hands. At any point, if a question comes up or you just want to have some conversation, want to discuss what the referral pathways look like, whether it's schools, DHS, law enforcement, judicial system, business owners, right? Reach out to Tammy, to Debbie, to myself. We really want to have these conversations. We want to make sure that what we are designing here is reflective of what we have been hearing from the community for many years. If we don't get it right, then let's work together to get it right. We own this challenge together. We want to own the solution together. So please reach out at any point. Thank you so much for joining. Please spread the word, check out the resources, make a donation. We really appreciate all the partnership and hope you have a great afternoon.
Thank you all.